now more than over 60,000 confirmed cases of coronavirus across the continent, with a number of African countries imposing a range of prevention and containment measures, this against the spread of the pandemic. Not many of these measures have been successful, but experts have warned that for Africa, the worst is yet to come. So, as a continent already struggling with sluggish economies, where do we go from here? Sawubona, welcome. I'm Dumelo Mutotwane, and this is #Africa. With the World Health Organization warning that Africa could become the next epicenter of the coronavirus pandemic, a new survey has found that the continent has less than one intensive care bed per 100,000 people. And when it comes to ventilators, some countries don't even have one.
At an airport in Belgium, medical supplies including masks and gloves are being loaded onto a cargo flight. Their destination, Africa. But as the World Health Organization warns the continent could become the next epicenter of the coronavirus pandemic, a Reuters survey has revealed gaping holes in the continent's health care, and not just in terms of personal protective equipment. Take intensive care beds. Reuters polling found there's less than one intensive care bed per 100,000 people in Africa. That's around 9,800. But analysis of scientific projections suggests that even in a best-case scenario, at least 10 times that number could be needed at the height of Africa's pandemic. The amount of ICU beds also varies widely. Chad, an oil-rich but impoverished nation of 15 million people, has only 10, whereas Mauritius, a financial hub home to 1.2 million, has 121. The same is true of ventilators. Across the continent, there are 9,300, but a third are in South Africa, with many in private hospitals. Some nations, such as Guinea-Bissau, have none at all. Mauritania has 1, Liberia says it has 6, Somalia has 19. Those ventilators need an oxygen supply, but the survey found a shortfall there as well. Kenya, for example, has nearly 300 ventilators, but a critical shortage of oxygen, according to a Senate report. Africa has recorded over 51,000 COVID-19 cases so far, a fraction of the estimated 3.8 million globally. But low levels of testing make it impossible to know the true scale of infection. The United Nations Economic Commission for Africa has said the continent could see nearly 123 million cases this year, causing 300,000 deaths. Testing capacity has expanded sharply, but the continent has still carried out only around 685 tests per million people, according to a tally of figures from the Africa Centers for Disease Control and Prevention. By comparison, Europe has carried out just under 23,000 per million. As John Nkengasong, director of the Africa CDC, has said, if you don't test, you don't find.
Well, Dominic Jomo is a frontline doctor in Cameroon. He's used to busy days, but battling the novel coronavirus has changed his life beyond recognition. More than 20 healthcare workers in the country have tested positive for COVID-19.
Caring for patients has become a 24-hour-a-day job for Dominic Jomo and his team as they battle the influx of patients at this hospital in the Cameroon city of Douala. Working shifts that encompass an entire day, he's constantly putting on and taking off personal protective equipment, fighting a torrent of new cases. The anaesthesiologist's life has changed beyond recognition since the first infections were detected in Cameroon 2 months ago. He's clear, though, about why he's doing it.
I want to personally play my part so that at the end of this epidemic, I can be satisfied with what I've done, to have the feeling that I gave all of myself and that I did not do less than I could.
The picture in Africa is still far calmer than what's been happening in the United States and Europe, but health facilities in sub-Saharan Africa are even less prepared for a pandemic and patients needing serious care in hospital.
C'est tout un autre monde.
It's a different world. It's not the same type of care that we're used to.
Il y a beaucoup plus de précautions à prendre.
There are lots of precautions to be taken. Every move will take a lot longer to provide treatment, to dress correctly, to disinfect, and so on.
C'est la principale.
That's the main challenge, but we adapt with time, and as the days go by, we improve.
On s'améliore.
Last week, when a Reuters crew visited the hospital, the resuscitation ward was full, its 12 beds occupied by patients. But Dominique has pledged never to turn away a patient.
Tout le monde peut être malade.
Anyone can fall ill. I can come to the hospital and see a friend come in. I will not turn my back on him. I will take care of him. For every job there is a risk and, well, we do it and take precautions. That's all.
His own family and friends worry he may get infected, as in many parts of the world, protective equipment is running short for medical staff. More than 20 healthcare workers have been infected in Cameroon, and a senior health official said at least 2 doctors have died.
How about some good medical news for a change? Not to Kenya. A new study by researchers found that a microbe can completely prevent mosquitoes from carrying malaria and could help prevent the disease around the world.
Researchers in Kenya discovered a microbe that can completely prevent mosquitoes from carrying malaria. According to the study published in Nature Communications, the microbe could be used to check the spread of malaria around the world. The research teams from the UK and Kenya found that the malaria-stopping fungal microbe called Microsporidia MB was present in 5% of the mosquitoes they sampled. The fungus grows in the genitalia and digestive system of mosquitoes, and the data suggests it is 100% effective in stopping malaria from infecting mosquitoes. Speaking to the BBC, the authors say they do not as yet know how the fungus stops malaria. The paper's lead author, Jeremy Heron, says at least 40% of mosquitoes in a region need to be infected with the fungus to curb malaria transmission.
Now, after the break, profiteers pounce in the DRC and a warning from Senegal's holy city. Stay tuned.